The three positions we'll focus on next are lateral, Sims, and prone positions. Lateral, side-lying, position places the resident on their left or right side as shown in the image above. The top arm and leg can be placed in a flexed position in any range that is comfortable to the resident. Supports should be placed behind the back to keep the resident from rolling to the supine position. The top arm and leg can be placed in a flexed position in any range that is comfortable to the resident. Supports should be placed behind the back to keep the resident from rolling to the supine position. Additionally, supports should be placed between the top knee and the bed, or other knee, and between the top elbow and rib cage or the bed, depending on the location of the elbow joint. These supports will alleviate pressure between the bony prominences in these areas. The pillow underneath the resident's head should also be adjusted for comfort and alignment checked from the foot of the bed. This position relieves pressure on the coccyx and can increase blood flow to the fetus in pregnant women. The most common rotation of positions for repositioning residents is to rotate them from supine position to lateral position to lateral position, to supine position to lateral position on the opposite side. A skills checklist can be found later in this module discussing the steps further. Sims position is very similar to the lateral position, but the client is always placed on their left side and their left arm is placed behind the body, rather than in front of the body. See the image above of a patient in Sims position. Sims position is commonly used for administration of a suppository or an enema. Depending on your state's scope of practice, you may be delegated to give an enema, or the nurse may ask you to prepare the patient for an enema by placing them in the Sims position. In the prone position, the client is placed on their stomach with their head turned to one side, as seen in the image above. Pillows should be placed underneath the shins to relieve pressure. Pillows or wedges can also be placed on both sides of the patient, and the head pillow should be readjusted for comfort. Prone is the least commonly used position, especially in older adults, due to their neck immobility. This position may be used for a client with a surgical wound on the back side of their body, or to improve respiratory status in clients with respiratory conditions like COVID-19.